Hi guys, Dr. Robert Stevens here from the Men's Health Clinic based in Poole, Dorset. Now the focus of this video is how to manage estrogen on TRT. Now, do you need to manage estrogen on TRT? Not normally. With the correct protocol, your estrogen level will be within range. There's a small minority of people who have increased aromatization. That's a genetic predisposition. Some guys, heavy drinkers normally, people who are obese can have problems with estrogen control. But normally, on the correct protocol, people don't have issues. Do you react to a high estrogen level? Well, you need to take everything in context. So have a look at the testosterone level. So if the testosterone is high, the estrogen will be high. It's one of the chemicals, it's what the hormone testosterone gets broken down to. So you will have a high estrogen if you have a high testosterone. So how do you manage it? Well, you reduce the dose of testosterone. It's not rocket science. So you either reduce the total dose of testosterone and or the injection frequency. Same can be applied to HCG. Either amend the total dose or increase the frequency of injections. Aromatase inhibitors. Less than 5% of my guys are on an aromatase inhibitor. With the correct protocol, they are not necessary. If you need an aromatase inhibitor and there's no issues with regards to genetics, obesity, lifestyle, etc., then you're probably trying to justify a super physiological level. That's not something we subscribe to. We've got guys who have got levels between 20 and 40 nanomoles per litre. We tend to concentrate on the qualitative symptoms rather than the quantitative measures, and I think that's the difference. You know, I've got ex-bodybuilders who have never been healthier, never felt fitter, never felt stronger with a testosterone of 20. So chasing high numbers is a road to misery. We go on how you feel, not necessarily constant numbers. So symptoms of estrogen excess. Now the number one thing that everybody's worried about is breast tissue development, commonly referred to as bitch tits in the gym, and persistent nipple soreness. Now, I can assure you that's extremely rare on testosterone replacement therapy. Loss of libido and erectile dysfunction. Again, something you don't want to have. So, you have to understand that these things are multifactorial. So, it isn't always estrogen. So, you do need to have a chat with your TRT doctor and get blood work done. Other symptoms, water retention. Again, there are other causes of water retention. Anxiousness, brain fog, these things, they're all multifactorial. So you do not put everything down to estrogen. Get your blood work done, talk to your doctor. Come up with a plan. Keep it simple, keep it safe. Now the commonest test here in the UK is the standard estradiol test. 99 times out of 100, that is perfectly adequate. Now, the gold standard is LCMS estradiol test, the sensitive estrogen test. Now, that measures your estrogen via liquid chromatography mass spectroscopy. It's a bit of a mouthful, but yeah, we got there in the end. So, that is the gold standard. However, it's very rarely necessary. And the results, unfortunately, here in the UK do take 3 to 4 weeks to come back. So, what's the problem with the normal test? The only problem with the normal test is, unfortunately, it doesn't differentiate between estradiol and the inflammatory marker CRP. Now, as long as you know that, then you can make the necessary amendments and adjustments based on that knowledge. Now, again, 99 times out of 100, as long as you're aware of that, there's no need for the LCMS test. However, we do have access to it here at the Men's Health Clinic. So, how do you manage estrogen? Dose adjustment, plus or minus adjustment of your frequency of injections, of either or and testosterone and HCG. It isn't rocket science. Keep it simple, keep it safe. Don't have a knee-jerk reaction to excess estrogen symptoms because it might not be estrogen. Speak to your doctor, get your blood work done, and go from there. Ta-da.